I will show you how it can look. This is a 12-year-old girl, which all of a sudden, after a little sport accident, had a little thing on her ankle, nothing special. And suddenly, half a year later, it turned red, like you can see it on the picture, and it started to hurt very intense. She couldn't walk anymore, and nobody immediately know what is going on. But she was very lucky to see a doctor who told her quite fast it's a CRPS. But her bad luck was that 6 months later, it turned out that also the other side became the same symptom. You can see it on the picture that she cannot roll out her toes anymore, so she couldn't even walk anymore. And how can we do therapy with little children who cannot walk? And when they touch water, that happened to her. She always gets a very painful tremor. And that means nobody is allowed to touch her. Nobody can do physiotherapy with her or anything to help her to get rid of what is her issue. And now she's sitting in a wheelchair. And this is for a 12-year-old, of course, something very, very difficult. And she had to learn how to untie her internal knots because, of course, she's always protecting herself and is trying to protect her that nobody gives her more pain. So we first need to move, and then the pain can disappear. People always think when we have a pain, we have to wait until the pain is over, and then everything will resolve by itself. But with CRPS, that does not work. So what do these little children suffer from? They have real pain. A lot of people don't believe them. They cannot move. All of a sudden, they are in a wheelchair. A totally healthy child turns to a handicapped child. And what they have to learn to accept that they have to overcome this painful situation and move and not wait. And there's always a sign. I don't know if you can see it. It's telling me if I want to share or not to share.
Yes.
And I press share, and then something strange is happening. Let's go on.
Yes.
Okay, there we have already been.
Yes.
What is medical hypnosis? It's a focused attention inside of us. A lot of people think hypnosis has to do with magic or something because we have the show hypnosis, which always disturbs what the real medical hypnosis is about. So what can we do? We can access unconscious processes inside of our body. And this is so useful for a lot of things where the normal treatment, the medicine, does not help anymore. When we work with medical hypnosis, we have to understand it's a support of everything else what the patient is already doing. So if he's taking medicine, of course, we support his situation and try to do something even more extended for him. So hypnosis is a method, and the state, for example, this child gets into work is called trance. And what they see when we work with trance, we see, for example, inner pictures, but not only pictures, we get also sensations. We feel our body if it is real what we see. It's like, everybody knows it when we dream, that it can be sometimes really real. And this is the same what we have in hypnosis. And only for the people who haven't seen CRPS that often, only a little explanation. For example, it comes very often on the feet and on the hands. On the lady on the left side has a more colored left feet, it's red, and she had only a little sprain, which was almost nothing, but all of a sudden this red foot and very painful area started. And you see on the other side a young lady. She's a very important swimmer in Germany. But after a little operation on a ganglion on her right hand, she became CRPS. And now when she trains, she's doing exactly what you see. She's guarding her arm. She does not touch the water anymore. So she's swimming with one arm and two legs. Of course, she cannot do any competitions right now, but she's not able to touch water because it hurts. So what is the definition? The definition is an inflammatory pain disorder. It's a severe pain that expands beyond the affected area and is always disproportional to the trauma. And it's very difficult to be overseen because there's no blood tests, there's nothing special. All what we have is the Budapest criteria, and the Budapest criteria is a list of different symptoms, and there are 4 categories, and if you see the different categories, you have to find in each or in 3 of the 4 topics one symptom, and then we think it could be a CRPS. So what are the treatment options? The patient is suffering from pain. It's a special pain. They call it a burning pain. It's different. And because it's so painful, they start not to move, for example, the arm or the leg. They put it in immobility. They have reduced function due to the immobility, due to the edema which is building up, due to the pain, and they carry all the time their arm, for example, in a very strange protective posture like this. And what happens very often that they also become a disturbed body perception. What does that mean? They carry their arm here and they have to check visually, where is my arm? Even though it is hurting, and we should think when something is hurting, we should know where it is. They have no idea where in the room is my arm, so they have to take a visual contact. And there are a lot of medicines like glucocorticoids which help often against the edema, but all what we can say, all the patients I see, they have tried a lot of medicine, and this is why they come, because nothing has helped, or nothing has helped in the dimension that they are happy. And here you see, for example, a young lady. She's in this position and she doesn't allow anybody to touch her. She doesn't wear any sleeves. It was in winter when she was coming. And our first thing was to put on this special cream, DSMO, to give her the possibility to dare a sleeve. And you see, these are the little points there. And we, of course, used hypnosis to allow it. I asked her, what kind of touch do you like? And she said, I like to touch horses. So we imagined that a very soft horse is touching her arm while I was allowed to give her the little spots on her arm. Here you can see mirror therapy. Mirror therapy is very often used to give your brain the image that both hands are okay. So one hand is behind the mirror, the affected hand, and the healthy hand is in front of the mirror. So you try with a visual feedback to make an illusion in your brain that both hands are fine. But it's a very good technique. But what do I not like about it? It's only working as long as the brain believes the illusion. And our brain is very smart, so it sometimes only takes 2 minutes or 3 minutes until our brain is not happy anymore with the picture and doesn't believe it anymore. So it's only a short training time. And I see children training this and they go over the point where the brain already does not believe anymore that this is a second arm. So they do something which is not effective. It's very effective if you do it many times for a very short time. And so mirror therapy only uses the visual feedback. And what is very good about it, when we use hypnosis, we don't only use the visual feedback, we also use everything else, what I will show you later. And another problem is, if you remember my first little child from the beginning, she has CRPS on both feet. So how can she do mirror therapy? There's no chance. And when we work with medical hypnosis, we work with all senses. We allow to go in an inner, for example, comfortable place or a safe place. For this little child, she loves dogs. This is my dog, which sometimes helps a little bit, but of course it gave her also safety, and she could concentrate on her inner work. And when we, in our inner mind, visualize in trance the movement of limbs, it's the same stimulation we want to do with mirror therapy, but it's not limited to a place, for example, where we have a mirror. It's not limited to pain. It's not limited to one limb. And it's not limited to time, because when we do trance, when we go inside of the trance, after 10 minutes, 15 minutes, 20 minutes, it even gets better. So what is a very famous and very effective thing is when in trance, we try to go in future. This is something we do very often, also when we work with sports, elite sports people, to go in future things. But with the CRPS, the issue is that the people always, when they go in future, take their problem arm with them. So this does not work immediately. What else can we do? We can go in the other direction. We can go backwards in time, for example, to work with real sense memories. We call it also age regression. Everybody had some experiences in our childhood before we were handicapped. So for example, for a CRPS patient, that could be that he remembers playing soccer. And then when he has all the sensation internally, he's playing soccer, he can grow inside and can become bigger and bigger. And then with this good feeling where everything is working, also the affected limb, he can go in future times and see how he can drive again a car or handle something. Here's an example from a 20-year-old dentist. He had a fracture on his right foot when he was kite surfing, and you can see that the foot does not look that bad, but he went himself in the psychiatry because he could not stand anymore, even though he had already all medication you normally give. And then he came to say me, and the first words was, if you cannot help me, I need an amputation next week, because there's nothing I want to do anymore with this leg. It's hurting so much. So what could I offer him? I offered him to tell me a little bit about his resources, because in hypnosis, we take care of resources. Resources are things what we like. Resources are things which we have already experienced. So one of his resources is his car. And he told me he has an old Spider and he loves his car. So I asked him if he can remember 1 year ago, 2 years ago, a nice drive where he was going in his car. So in trance, I allowed him to have a nice drive in his car. He could feel the wind in the hair. He could feel the sunshine. And I allowed him to drive faster and faster. What did he need to drive faster? His red foot on the gas pedal. He didn't recognize in trance that all of a sudden, in trance, he could use his right foot. So we were working on this issue that he enjoys using his right foot. And he was driving the car, and when he came back, it took a while, and he said, I need my right foot. I know it because I love my car. So the discussion of the amputation was gone immediately. Sometimes we can do something very special, the integration of the extremity, to visualize something around us which makes us whole. And this is something where we don't have any medication. If the hand doesn't feel connected to the body, there's no medicine to help. So this is something where we allow them to have visualized something around them and then fill something inside and everything becomes one. We have to know that our patients experience very often that they get connected with medical doctors who are unfamiliar with CRPS, who don't believe that a foot, like I showed before from the dentist, is so painful that he cannot walk, that he cannot drive, that he cannot work. So the patient has always to prove that the pain is so strong. And this is not very good for our brain, because we always give our brain the input, I have to prove it, that I feel it, so I have to feel it right now. And this is another patient of mine. She came with 12 years, and you see on the right side that her right foot is already a little bit red and strange. And when I show you here in the video, you can see as soon as somebody is touching her foot, she gets a tremor as well. So she got sent into psychosomatic clinic because everybody thought her pain is exaggerated. And we worked with hypnosis. And what is very, very interesting, when we have so many different things, of course, what we can do, and I ask her to build a mini me of herself, a little figure of herself who's traveling through her body, and to check out everything what is going on. And interesting is, with almost 90% of the patients with whom I'm doing this technique, they travel to the place where the CRPS hurts most, and they find nothing. They don't see anymore any structure. They don't see any more muscles or bones. There's a hole or there's nothing. So what is our goal? We can build up this hole again, so that there's again a representation picture in the brain. And this is something what she told me how it would look like in her hip area, that there's a black hole. She cannot see anything, and there are no muscles, there's nothing. And what I always love, these were children, sometimes they were told, you will never walk again. She came with crutches. And this is what she sent like 2 days ago. And here you can see when she was swimming half a year ago, she couldn't move her right leg again. Maybe I show this video. No, sorry. Here we go. And this little girl was almost the same. She came in a wheelchair. I'm quite sure she didn't have a CRPS. She had a pain syndrome, maybe more traumatic, maybe different. But after working with trance, after working with how does the pain inside look like, how can I put my inner vision of my pain, how it looks inside, get out of my body, after a while she started trying to move again. And this is so beautiful when they get the courage again, because they are missing courage. There are so many times they are told, you will stay in a wheelchair forever. And this was a beginning, and now she is jumping, she's doing everything, and she's a happy little girl again. And this is so nice. I'm sorry, there's something strange with the presentation. It's coming again. And one of the most important modern hypnosis teacher is Milton Erickson, a psychiatrist who lived in the United States from 90 to 1980. And he was a pain specialist because he himself had a lot of pain issues. And I like his sentence very much, that it's our responsibility to create joy, because pain comes all by itself. So this is something what I try to teach all my patients, that it's not about me doing a hypnosis with them, it's about them taking their inner pictures and creating their power again, their strength again, to build inner pictures of being whole again. And this is what I call to unknot the inner knot. And patients often report that they're confronted with so many negative suggestions, so that they are not believed, and the insurance company doesn't want to pay because they are not sure if it's a CRPS. So one of my clients once said, I wish I would have a cancer. Everybody would believe me, but with CRPS, nobody is believing me. So what I did, I reframed the word CRPS and said, how would it be if these 4 letters, CRPS, which normally you would say means create a chronic regional pain syndrome, would from now on mean create your personal solution. Because they're in such a special situation, there is no solution which is straight, which is clear. So we have to create personal solutions. So with this new reframing of the words, CRPS, create your personal solutions, we make a little trance where they can see what would be next, what would be one of their next little goals, what they could reach, and how can they reach it. And this is the little lady from the beginning again. And she said, okay, I understood. I have to have touches all over my body. I have not to focus anymore on my feet. And then I can go on and train. And this is the most important thing. And if you can see like this vicious circle where all the hypnosis things can dock on, these are the pink things, the integration of the affected limb and the mini-me, this can work with a disturbed body perception, and all that can dock on different things. So we have multiple possibilities to not only work with the limb, but to work with every part between the limb and the brain to strengthen these little children and also the adults. And of course, it's not necessary to have already a diagnosis of CRPS. You can start immediately in the moment where there's some kind of strange happening after fracture or after another incident. So there are no side effects. So this is something everybody, in my opinion, should learn in a way to avoid all the negative things when we come in the situation of CRPS. And sometimes I explain them also that suffering means pain times concern, because all the CRPS patients, they have a big concern. They look up in internet what it looks like, what it could happen, so they are full of fear. And the concern, and we know that in the prefrontal cortex, makes it much bigger. So I ask them, what do you think would happen to your pain if you don't have any concern anymore? And for the little children, they understand immediately that the concern makes the pain much bigger. Yeah, and this was it for today, and I hope that you get the idea that hypnosis is something what you can use right from the beginning to not only rely on medicine, but to use also your inner power, your inner energy, and your resources with your visualization to get a chance to become whole again. Thank you very much.